Good evening, everyone. I'm Preeta Harikrishnan, the Deputy Manager of Admissions at Amrita Health Sciences, Kochi campus. It is my pleasure to warmly welcome each one of you to today's webinar. I would like to provide an official introduction to our esteemed guest, Dr. Usha Menon, ma'am, Clinical Professor in the Department of Endocrinology and Diabetes at AIMS. Dr. Usha, ma'am, is a respected member of our department, specializing in diabetic sciences. With her extensive expertise and knowledge in this field, she is dedicated to offering valuable insights and guidance to individuals interested in pursuing courses related to diabetes. We are truly honored to have her with us today to share her insights and address any questions you may have during this informative session. I would like to extend a heartfelt invitation to Dr. Usha ma'am to enlighten us on the scope and various opportunities within diabetic sciences. Welcome, Doctor.
Yeah, thank you. Thank you, Preeta. Am I
Thank you.
audible?
Yes, ma'am. Yes, ma'am.
Okay. Is my screen visible?
Yes, ma'am.
Is it in, it's not in slideshow mode, I think. It's
No,
not.
it's not in the slideshow mode.
Yeah, now it
Yeah,
is.
yes, yes.
Okay.
You may start, ma'am.
Okay. So good evening, everyone. I'm here to just highlight a course which has been going on in our department for more than 15 years now, more than 15 years. So this is B.Sc Diabetes Sciences and M.Sc Diabetes Sciences. So this is offered by Amrita Vishwavidyapeetham, which as all of you know, it's ranked among the top 50 universities in the world. And it is the best fourth university in India and best private university in India for the last few years now. So this has been offered by Allied Health Sciences section of this university, and this is located in Amrita Health Sciences campus, Kochi. So the B.Sc and M.Sc Diabetes Sciences are actually basic health science degrees, and this course is intended to train diabetes educators who would assist doctors in their clinic in managing diabetic patients. Diabetes educators will be able to counsel patients about diet, initiate insulin therapy, provide psychological support, etc. So this is an important paramedical course offered by our department. And to highlight the importance of this course, I need to tell you a little bit about diabetes. So I think most of you might be knowing about diabetes because it's it's most common endocrine disorder in the world, and it is actually on the rise because it's going up steadily over the last few years, and at present it has been considered as there are about 422, about 500 million adults with diabetes in the world, and this is expected to go up to 700 million by about 2045. So this has been steadily or more, it's not steadily, it's an explosive growth of diabetes in the world, and this amount to 1 in every 11 person is a diabetic. So that's quite a large number of diabetic patients in the world. And the most important problem is that it's a major leading cause of death in the world. And this amount to about 1.5 million deaths caused by diabetes in the world. So that's quite a large number of people are dying from this disease. So if you look at the statistics in the world, in India, in 1975, only about 2-3 states in South India, like that, those in pink color, are considered to have more than 12 percentage of diabetes. Whereas by about 20-25 years later, if you look at the Indian map, you can see more and more states have become pink in color. And if you take the statistics now, almost all of the states are the same color. So this has been exponentially growing in India. And it is said that 1 in every 6 diabetic patient in the world is an Indian. So it's quite common problem in India, and we have about 77 to 80 million people with diabetes in India. So that's a large number of patients with diabetes. So what's the problem? This all diabetes is not the same. There are different types of diabetes. Type 2 diabetes is the most common disease and it comes about 90 percentage. And here the body produces insulin but it's not working well. And so most of the time patients are asymptomatic. Only about 50 percentage of the patients with type 2 diabetes know about it. And there is a small percentage of type 1 diabetes where there is no insulin production and usually happens in children and they need daily insulin injection to live. And there are other types of insulin diabetes as well. They may need insulin, they may not. So the problem with diabetes is that this large majority of type 2 diabetes is called a silent killer because it can cause damage if it remains uncontrolled to the small and large blood vessels, and it can cause stroke, blindness, heart attack, kidney failure, foot ulcers, infection, and actually amputation of the legs. I'm sure those who are listening, at least one person in your family may have diabetes, and they may not have any symptoms. So the problem is that we are trying to treat a disease without symptoms to avoid complications in the future. I think you can imagine how difficult it can be. If you have fever, you will take some treatment. Once you don't have any symptoms, you will stop taking medicine. That's the human nature. So that's where all the importance of diabetes education comes. Because if you look at this food, this is quite normal and it can have changes like this, and it may become like this, and it may end up losing toes and even the whole leg. All this because they don't have symptoms initially and they're not aware that these problems can occur. So the lack of education is the major problem, and most of the problems are preventable through education of the patient. And basically, diabetes management, goes around in the diet control, counting of what you are eating, and adjusting medications, taking tablets and insulin properly, doing exercise, monitoring blood glucose, etc. So 90 percentage of the diabetes care is in patient hands, and it's not just one day, not a week, not a month. It's all round the year throughout their life. So that's quite a lot of job. The patient need to know a lot about this disease. If you have asthma, you don't need to learn about asthma to treat that. But if you have diabetes, you need to learn a lot, especially like meal planning, self monitoring, exercise, what are tablets you are taking, what are the side effects, what should you watch out for, what you should do when it is high, sugar is high or low, how to take care of the food, and how to do, when to do test, what sort of test, if you fall sick, what to do. And they need to learn to manage all these gadgets like insulin injection, insulin pen, and glucometers, all those. And there are a lot of technological advancement that has happened in diabetes, where you are using continuous glucose monitoring system, where you attach that button like thing and it monitors sugars every 15 minutes and send it to your an Android phone, or you can flash it over the thing and get the reading. And similarly, there are insulin delivery system like pump. All these are technology based things, and this need a lot of assistance for the patients. So can the doctor do all these? Of course not, because he has so many patients to see and so little time to spend with the patient. So what the doctor cannot do can be done by the educators. So educator forms the link between the patient and the doctor, and they forms the central pillar of diabetes care team. So he or she is the person in constant touch with the patient and the family, transforming information into action, action to better outcomes, helping them to have behavioral changes, helping them to improve their targets and achieve a normal, healthy living with diabetes. So they act as a guide, friend, counselor, and link between doctor and the patient. And an educator can make a lot of difference in someone's life, and there can be quite a lot of improvement in their diabetes parameters. And so they form the central pillar of the diabetes care team. So it's a teamwork. So the important thing is that in 2021, they have found that only 1 in 2 in the world has a fortune to receive any diabetes education. So there's a 50 percentage of the patients never receive education. And this is mainly because there is a lack of trained person to provide diabetes education. So in Amrita Institute, we have been trying to fill up this gap for a long time, and we have designed these courses, and now they are recognized university courses. So the graduation is B.Sc Diabetes Science, post graduation is MSc Diabetes Science. So in B.Sc Diabetes Science, we have a 3-year course with 1 year internship, and eligibility is passed in plus 2 with 60 percentage aggregate marks in physics, chemistry, biology, and English. And the admission is through Amrita entrance test, which probably you are already written. And you need to have a decent communication skill, pleasant manners, and more, above all, some sort of empathy where you are going to help the sick people and to make their life better. And you need a lot of patience to do this. Because you are trying to help them have their, change their behaviors and follow them. And so, if you have such good qualities, you are an ideal person for this. So, in the first year, there is about 5 papers, and these are anatomy, physiology, biochemistry, computer, English, and this is done taught from the Amrita School of Medicine. Second year, they'll come to our department of endocrinology and diabetes, and whereas they still continue to take lessons on pharmacology, pathology from our School of Medicine, but we'll teach them basics of diabetology, pathophysiology, complications, etc., as well as education and psychosocial aspects of diabetes. Third year, they go deep into the clinical diabetes, nutrition therapy, podiatry, and also podiatry means the diabetic foot care, small procedures of foot care and all, and biostatistics, and they usually do a dissertation on a topics chosen by them. And the exams are conducted yearly, theory, practical, and viva. And the topics covered probably doesn't, make sense to you now, but it involves a lot of different aspects of diabetes, both practical as well as theory. And during internship period, you will get a chance to have a hands-on training in patient counseling and using all this technology, putting a CGMs, pump, and all these things, interventions, as well as teaching the patient through group education, one-to-one training, etc. And since 2006, after this has become a university recognized course, we have been training at least 4 or 5 candidates every year. And all of them who have been passed out were all 100 percentage employed, and they are all doing very well. So what are the career prospects of this course? You can work as an educator in clinics or hospitals with attached to a diabetes specialist, and you can become part of the diabetes care team. Second thing, nowadays lot of old people are living alone, living only the old couple are living. So most of them may not be able to go to hospital frequently, so you can have an education service and you can charge for that. And there are people who go around as a mobile service helping them to take insulin injection or CGMS, pump therapy, all these things. And you can have a startups of for entrepreneurship regarding all these things. And you can be attached to IT sector, or you can go into biomedical research. Many pharma companies hire people like you because they want to have educators who go around and teach about their products. And if you want to pursue further in your studies, there are this can act as a basic degree for admission into health analytics, artificial intelligence, and data management, as well as interdisciplinary studies in Ayush and other systems. This can be a very handy basic degree. And nowadays, everyone wants to go abroad. If you want to go abroad, this is a recognized degree in most of the countries like UK, USA, Canada, and Australia. You can work as a skilled worker, as a technician or a supervisor in healthcare sector. If you want to go into a management level, then you have to do some add-on course or a licensing exam in these countries. And you can also become community level of health care workers, but you need to have a good command of English for that. And if you want to do a further career advancement abroad, this can act as a basic degree, and you can go after a TOEFL or GRE for USA or IELTS for rest of the world. So you can go anywhere in the world. And though it may not be important to you, but we can I can give you just an overview of MSc Diabetes Science, which the eligibility is the B.Sc Diabetes Science course. So this is a 2-year course, and this is still not very frequently done, but because there are a lot of academic involved in this, and you are actually trained to become the trainer of the trainer. So that's it's very important because you need some faculty to teach the diabetes educator course. So after MSc, you can be a faculty in allied health science, or you can go to pharma companies as a trainer, and you can pursue further studies and get a junior research fellowship and become take a PhD or something like that. So there are a lot of opportunities and prospects for this course, and this is moreover, this is a very, very important job where you are going to help people to avoid complication and to lead a normal life and enjoy their life peacefully. So there's a lot of God's grace involved in this, and most of the patients really appreciate your help because many time doctors are not able to give them quality time for all these things. So we will listen to few videos done by our graduates who have passed out from here. Hello everyone. Can you hear? Working as lecturer in Department of Endocrinology.
Yes,
Reader?
yes, ma'am. Yes, ma'am.
21. I have completed my bachelor's and master's in diabetic science from Amrita. After graduation, I have joined in Astromims Kannur as diabetes educator and later on accepted the lecture post in AIDS. I could proudly say that I have witnessed the growth of our course as we were the first ever B.Sc diabetic science batch with 4 students in total. We four were able to acquire our positions as diabetes educator in hospital as well as company center. The demand of diabetes educators are projected to increase because of the increasing number of diabetic cases these days. Moreover, I think challenges limiting the diabetes education, such as poor understanding of what diabetes educators do and underutilization of diabetes education, continue to redress. So, thanking you for letting me share my experience, and I wish the future is awaiting for more diabetes educators.
Hi, I am Bhanupi Prakash, currently working as Diabetes Education Medical Trust Hospital, Kochi. I had my bachelor's in diabetes science from Amrita in 2019, and thereafter I joined a pharmaceutical company with a decent pay. So we were the third batch with 4 students in total, and we 4 were enrolled right after our graduation. So having gained an experience of 1 year in the company, I looked out to hospital sector for more exposure. You could also pursue your postgraduate degree in the same, but I chose to work. So I would say that choosing B.Sc diabetes science for my career as well as for my passion worked perfectly well for me. Um, Initially, we had some difficulties, as in where people didn't regard us because they weren't aware of the job title or the role we did in their lives. But gradually, we become a part of the healthcare sector with the more people approaching us with hope. And overall, I am satisfied with our role in helping patients manage their diabetes carefully with ease because providing technical support, clarifying their doubts, and above all, being emotionally available for them is something not all can do. So I, as a diabetes educator, is proud to have reached where I stand today. And thank you for letting me share this. And I hope that our course and our role in the hospital sector will reach out to everyone because I think there are still people who are not aware of us. Thank you.
Okay, so this is a health science degree, and you will get it from a world-renowned university. And I think you can serve, survive, save, and probably go and see the world. So all is possible with a basic degree in diabetes sciences. So I request all of you to consider as your first choice, because if you are smart and very good, there are a lot of opportunities where you can do a lot, and you can even take a PhD and pursue your career as a as a faculty. So all the best. Hope I have made myself clear in this, and if there are any burning questions, I can answer that. Thank you.
Thank you, ma'am. Thank you for that detailed explanation. Ma'am, a couple of questions, ma'am. Like, these students who are joining this program, what should be the essential skills they should acquire during the program?
You mean like, basically, it is good if you have a good communication skill, if you are pleasant and easy to be with people, because here you have dealing with patients every day, and you are actually trying to talk them, convince them, helping them, following them through, with phone and such things. So, and if you are good at English, that is an added plus point. And second thing, we'll teach a lot of basic diabetes and also this managing all these technologies. So if you're smart and pleasant and communicable, I think that's the basic qualifications you need.
Oh,
And I hope that's what that I
yeah.
have answered the question. Yeah.
Yes, ma'am. Ma'am, the future of diabetes care, like, in your opinion, these students, they have opportunities both in India and even abroad?
Yes, certainly. This diabetes educator concept has been in place in Western countries for more than 50 years. I think this is still coming up on in India. And as the burden of diabetes is so much in India, the scope for having a diabetes educator is now it's become a dream for many of the diabetes specialists. So they'll usually inquire by end of the year how many of the students are passing, please send one to me, I am badly in need of an educator, like that. So everywhere they are trying to hire people with this basic degree, though there are many other diabetes educator degrees. Most of them are either an online or a distant education or a 1 year course and observership. No course gives so much hands-on training. So our graduates are high in demand by most of the diabetes specialists. That's one thing. Second thing, from the government sector, health sector, public health sector, and private health sector, now the non-communicable disease prevention has become very important aspect. So hence more and more emphasis is given on and health education. So this can be a basic health education degree. So in that way also the employability is going to be much higher in the future.
Okay, ma'am. Thank you. Ma'am, the for our students who join the program, for them hands-on training begins from the first year onwards?
No, actually, they come to our department in the second year. From second year, they learn all the insulin injection techniques and glucometer testing, all those things, and then they slowly start the CGMS, applying CGMS, pump, all those things, and then they learn themselves first, and then they learn to teach the patients. So it's like that's what I'm saying. This is like more like a training the trainer. And then with the MSc degree, you are actually training the trainer's trainer. So like that,
Okay.
it's actually very very useful. And even for the family, if there is somebody like that in your family, your diabetes care can be much better. So I think this is an ideal course if you have the necessary qualifications. So I think especially because there are not much night duties involved, because most of them they finish the job by 5 o'clock. Maybe you get an occasional phone call. Most of those things can be managed by phone call, so there are no night duties. So these are the good thing about it when you are employed.
Okay. Ma'am, thank you so much. Are there any doubts from the attendees who are here? If
I
you
can
could,
see
if
some comments here.
any questions from your side? Any doubts to clear? I saw some of them raising hands, but now I don't see them. Maybe they are clear with what you said, ma'am. Yes, ma'am, let them come up with their doubts. Meanwhile, we have Priya from the admissions who will just briefly tell us on what the admission procedure is this year. Priya?
Thank you, ma'am. Good evening, one and all. I'm Priya, representing Admissions Office, Amrita Institute of Medical Science, Kochi campus. So today I'll be briefing on the admission procedure for B.Sc Diabetic Science for the academic year 2025. So we have 17 courses under Allied Health Science, and B.Sc Diabetic Science is one among them. So coming to the duration of the course, B.Sc Diabetic Science is a 4-year course, that is 3-year plus 1-year internship. Coming to the age eligibility, the candidate should have attained minimum 17 years of age and maximum 23 years of age on or before 31st December 2025. Now coming to the educational eligibility, you should be a pass in your class 12th with 60% aggregate marks in physics, chemistry and biology. And selection for the candidates would be based on the marks scored in the AEL exam, which is already over, Amrita Entrance Exam Life Science. So now moving on to the first year fee structure, we have 3 categories in the tuition fees: scholarship, non-scholarship and NRI. Tuition fees annually in the scholarship category would come around 90,000. In the non-scholarship category, around 1 lakh. And tuition fees in the NRI category is 2,500 US dollars. Also, we have another fees of rupees 39,600 annually, and admission processing charge of rupees 2,500 only for the first year. And hostel and mess fees annually would come around 80,000 rupees. However, hostel is not compulsory if you are residing within 20 kilometers from the campus. So, as you all know, AL examination is over and the results are already published. So, candidates who have not checked your results till now, you can log into your portal, that is registration portal, applyug.amrita.edu. In that, in the second step, course, you can click on My Applications. So, when you click on My Applications, your entrance rank, AL 2025 rank would be published. You can check that. And after checking your AEL rank, there are 3 more steps that you need to do. First, you have to enter your class 12th marks. So in the screen right now, as you can see, it's pending. So candidates who have not uploaded your class 12th marks can click on update academic details. So when you click on this, you will go to the fourth step of the application, that is academic details. So here you have to enter details like branch, board, year of passing, 10th percentage, 12th standard, etc. So candidates who have written your class 12th examination this year might have given the 12th result status as awaiting. So as the results are already published, you have to edit this option. Click on published. So when you click on published, this would be the screen. That is, you have to enter your class 12th marks. If it's out of 100, you have to enter maximum marks as 100. If it is out of 200, then as you can see in the screen, you have to enter marks out of 200. Okay, so this is mandatory. You have to enter your marks, save and proceed. So as I've already told in the earlier step, next you have to upload your class 12th mark sheet. Can click on upload mark sheet, then you'll be going to the last step of registration, that is document upload. Candidates who have not uploaded your class 12th mark sheet need to upload here. So like the candidates who have written your class 12th examination this year might not have gotten your original mark sheets. So you can upload, for the time being, you can upload the PDF of the marks that you have seen online, okay, from the CBSE or state website. So for the time being, you can upload that mark sheet, but this is mandatory, okay? So once you've done this, as you can see in the screen, the status would be changed to completed. After this is a very important step, that is, you have to register for CSAP, that is centralized seat allotment process. So as you can see in the screen, the CSAP registration, there's a tab that shows click here to complete CSAP registration. So you have to click on this, click here. So before like registering for CSAP, these are some basic detail like instructions for candidates. As I've already told you, you have to already enter your +2 marks and your mark sheet. Also, make sure that you meet the eligibility criteria of your preferred course. We have given in detail the eligibility criteria for all the courses in our website, amrita.edu/admissions. Make sure you check your eligibility before selecting the preferred course. So after this, you can go like see in the screen, centralized seat allotment process. So when you do the click here option, this is the screen. So right now you can see the CSAP registration status is pending. CSAP basically refers to the process where the candidate is once again asked about your course preference. Already you have given your preferences when you have registered for the exam, but once again, they are asking you the course preference. So after checking the eligibility, you have to fill your preference. So as you can see, first option, you can select your campus program. There is a provision for add option. If you have more than one preference, you can add option. Click on the respective campus program and save. Okay. So once you've done this, you can click on the option submit the preference. Okay. Submit the preference. So once you've done this, you'll get the screen like this. Preference submitted successfully. Make sure that you've completed the CSAP registration because this is very important. Until and unless you complete the CSAP registration, you won't be considered for first allotment. So make sure that this like instruction like this, preference submitted successfully has been saved by you. Okay. After this, we are conducting an online counseling session related to the admission process and the details about the allied health science program. So it is mandatory for all the candidates who have given your preferences in allied health science program to attend this session. Please note that this session is online. The session is online, so you can register for this session. We are conducting this session in 2 days, that is May 31st and 1st. So a candidate needs to attend any one of the session in any one of the time slot. There are two time slots, 10 a.m. and 2 p.m. So you have to register for that also. It is mandatory for candidates who are given allied health sciences preference. Okay. So the link for that also, like you can see in the screen right now, click here to join the session at that time. Like for example, in the screen, like you can see right now, if you've selected May 31st 10 a.m, you can click on this session at that time. Okay, so make sure you've registered for this. And also like since we are receiving many queries from candidates, this session is completely online also. So once you've completed the CSAP registration, you can like print your academic preference also. Now coming to the seat allotment and fee payment process. So we are expecting the first allotment results to be published by first week of June. So if you receive your first preference, the candidate gets allotted to the first preference itself. You have to pay the tuition fees and other fees through the portal, that is your registration portal, applyug.amrita.edu within 10 days to confirm admission. All these instructions would be clearly sent to you via mail. So if candidates who have been allotted a lower preference, like second, third, or fourth in the first allotment, would like to go for a higher preference, in such cases, those candidates are required to pay rupees 50,000 and wait for the second allotment. Also, it's important that those candidates should give an upgrade option also. Upgrade option is not required if you have been offered your first choice in the first allotment itself. It's only for candidates who have been allotted a lower preference in the first allotment and would like to go for a higher preference. And candidates who have opted upgrade option may or may not get one of the higher options in the second allotment. So candidates who get their desired preference in the second allotment can make the balance payment uh, by deducting the 50,000 rupees. Okay. If in the second preference allotment also, if a candidate does not get the desired preference, they can withdraw from the counseling. So for any admission related queries, you can contact in these numbers that are displayed in the screen right now, or you can send us a mail to ugadmissions@aims.amrita.edu. Also, a very important piece of information that Amrita Vishwa Vidyapeetham has not appointed any agent or third-party client for securing admission to any program. So students are requested to contact only in these numbers that we have given in the screen right now. Thank you. Over to you, ma'am.
Thank you, Priya. That was very briefly but clearly explained. I see Shakti Sevak. You have a doubt? You could ask your doubt now. Please unmute. Shakti Sevak. Please unmute. You could ask your doubt. Shakti, are you there? You could unmute and speak. I think I don't know, ma'am, if he or she's there. Anyway, if I don't see any other doubts in the chat box as of now, so this was a really great session, and I'm very thankful to Doctor for that detailed explanation. So it's been a pleasure to see you once again with us, ma'am. And I extend my sincere gratitude to you for all your valuable contributions that you did towards this webinar today. And I also thank each one of you over there who have attended this webinar. We also have the counseling sessions tomorrow and day after. Please join for all details on allied health science courses that you are really preferring. And with this webinar, which you enjoyed, which you have enlightened yourself, please see that you try your best to join Amrita. And we hope to see you very soon here after the allotment session. So, wish you all a wonderful day ahead and a chance in our campus too. Thank you once again. Thank you, ma'am.
Thank you, and hoping to see some smart guys and girls coming to our department.
Yes, ma'am.
Okay.
Very soon. Yes, ma'am.
Okay. Yes.
Thank you, everyone. Thank you.
Thank you. Bye bye. Have a
Bye
nice evening.
bye, ma'am.
Bye.